One rotator cuff muscle starts arm abduction, another externally rotates the arm. Mix them up and you'll miss easy step 1 points. Here's how to remember all four in under 60 seconds. Welcome back to MedBites, Anatomy Made Simple. The rotator cuff is a group of four muscles that stabilize the shoulder joint. So here we have the shoulder, right? Here's the joint, and we've got the four muscles. The easiest way to remember them is using the mnemonic SITS. Okay, so what do they stand for? It stands for supraspinatus, infraspinatus, teres minor, and subscapularis. And here's how I never confuse teres minor with teres major. A lot of students confuse it. They don't know whether it's teres minor or teres major. Like in the stress of the exam, they just forget it. So a quick way to remember this is by writing the mnemonics as uppercase S and I, lowercase t, and uppercase s. So this lowercase t is going to remind you that this is teres minor and not teres major. Now, all four muscles receive fibers primarily from C5 and C6. And let's talk about the two highest yield muscles. First, supraspinatus. Now, supraspinatus, its job is to initiate the first 15 degrees of arm abduction. The remaining 15 to 90 degrees is done by the deltoid. That's where it takes over. Now, a supraspinatus injury is assessed with what's called an empty can test. What you do in an empty can test, and they're going to describe it instead of telling you whether an empty can test is done or not, is have the patient raise their arms with their thumb pointed down. So if this is the patient, right, and this is their arm, or, well, the arm will be down, right? And this is going to be their finger. Their thumb is going to be pointing downwards. So like this is what it's going to look like. And they're going to try to raise it, right? They're going to try to raise this and resist downward pressure. So you as the physician are going to be putting your hand over here and putting a little bit of resistance and pressure downwards while they're raising it upwards, and pain or weakness would suggest a supraspinatus injury. It's not confirmatory, it's suggestive. Now, next, infraspinatus. Now, infraspinatus, its main job is external rotation of the arm. Now, an injury can cause weakness with external rotation and is commonly seen in overhead throwing athletes. So, what kind of sports do these guys get injured in? Think of stuff where you throw a ball. So, baseball, for example, or cricket. You know, the pitchers, that's the guys who are most prone. All right, and that's it. If this helped, save this video so you don't forget it before your next anatomy exam. Comment another anatomy topic you'd like simplified. Follow MedBites for more high-yield medical content, and stay tuned for my free PDF covering 20 high-yield concepts every medical student should know.